President Obama's health care reform may be the law of the land, but that is not stopping a growing number of Republicans from fighting against reform, including blocking Obama's nominee to run Medicare and Medicaid. Now, his name is Dr. Donald Berwick. He currently runs the Institute for Healthcare Improvement in Cambridge, Massachusetts. Supporters say his success in cutting hospital infection rates and his willingness to explore new ways to improve techniques and procedures make him the perfect man for the job. But his detractors in the Senate say Dr. Berwick is too fond of the British healthcare system, which they say is wrong for Americans. And one of those fighting Berwick's nomination is Senator John Barrasso, a Republican from Wyoming, also an orthopedic surgeon. He is known by many as Wyoming's doctor. Senator, good day to you.
Thank you, Alex.
I understand that this is somewhat personal with you, isn't it? Can you explain why?
Well, you know, for the last 5 weeks, I go to the Senate floor every week with a doctor's second opinion about this health care law, which I think is not going to help get down the cost of care. It's actually going to raise the cost of care. It's going to make it harder for people to get care in terms of availability and the quality of their care. So I have great concerns with this nominee to head Medicare and Medicaid, because he loves the British health care system to the point that he's been knighted. And it has to do a lot with limiting care by rationing care, and that's what Americans don't want.
Okay, so that's what you don't like about the British aspect of things. Is there health care rationing there?
Well, the real problem is that the survival rate for patients with cancer in the United States is much greater than it is in Britain. And my wife is a breast cancer survivor. She found her cancer through a screening mammogram. But in Britain, in England right now, if you are diagnosed with cancer, the goal, the aspirational goal, has come out in their prime minister debates, is to have the operation within 18 weeks. Well, you know, for somebody who has cancer and they know they have that diagnosis, they don't want to wait until September, Alex. And the reason that the survivors are much better, the survivorship is better for cancer in the United States, it's not that our doctors are better, it's that our patients are getting treated so much sooner.
Senator, let's listen to what the White House says about your objections to Dr. Berwick. Let's take a listen to that. I'm sorry, I'm going to read that for you, and it's as follows. No one is surprised that Republicans plan to use this confirmation process to trot out the same arguments and scare tactics they hoped would block health insurance reform. The fact is, rationing is rampant in the system today as insurers make arbitrary decisions about who can get the care they need. Don Berwick wants to see a system in which those decisions are transparent and that the people who make them are held accountable. Transparency here being the key to the difference in what you suggested was being done. Do you have a problem with that? I mean, might that help things a lot?
He calls it rationing with eyes wide open, but he admits he wants to ration care, and Americans people are not going to tolerate it. So the White House has their big PR campaign going to say, hey, this health care bill is good, when the American people have overwhelmingly rejected it. The president never did get the bounce he was hoping for in the polls, because the American people believe that they're going to end up now, because of this law, paying more for their health care and getting worse quality of care. My number one criticism, though, through this of the president has been that he would not bring a name to Congress while he had his bill being debated on the floor. When he is talking about cutting $550 billion from Medicare, there was no one running Medicare and Medicaid from this administration to come and answer what that means for our seniors. When he was talking about cramming 18 million more people onto Medicaid, a program where half of the doctors in the country won't see those patients, Alex, there was nobody running that division for the government through the first 15 months of the presidency to talk about what the impact that was going to have on the system. So the president basically refused to have anyone answer those questions until this bill was crammed down the throats of the American people, and now he brings out somebody who loves the British system, which has failed tremendously the British people because it rations, it limits their ability to get care.
All right, well, an impassioned doctor and Senator John Barrasso from Wyoming, thank you very much.
Thank you, Alex.